Take a look at this close-up of a ballpoint pen being rapidly clicked. Along with chewing, breathing, and typing, it's one of the most common background noises you will encounter in any shared space. For the vast majority of us, a healthy brain automatically filters out these repetitive sounds. It categorizes the clicking or the chewing as harmless environmental data and moves on. But for a specific segment of the population, these exact same noises bypass that filter completely. They register in the brain not as minor annoyances, but as sudden, extreme emergencies. This graphic shows what happens the second one of those trigger sounds hits the ear. The listener experiences an immediate, involuntary physiological reaction. Their heart rate spikes, their muscles tense up, they begin to sweat, and they are hit with an overwhelming urge to flee the room. This intense physical reaction is a genuine, measurable biological event. The person experiencing the panic is not being dramatic, and they cannot control it with sheer willpower. To avoid triggering this physical panic, sufferers actively restructure their daily routines. They wear noise-canceling headphones constantly, skip public transit, and regularly eat alone rather than risk sitting at a shared dinner table. That avoidance comes with a heavy internal psychological toll. They experience deep guilt and shame after lashing out with immediate, unprovoked anger at a loved one who is simply eating a meal or breathing nearby. Because they don't understand their own erratic physical reactions, many people go years suffering in complete silence. They assume they have a terrible temper or a severe character flaw. The noise sensitivity forces them into hiding, systematically dismantling their social and familial life. This condition has a name. Clinicians call it misophonia, and it is widely recognized and documented in modern medical literature. In the misophonic brain, a distinct pathway directly connects the auditory cortex to the threat center. When a trigger enters the ear, it bypasses logic centers, setting off an alarm. This short circuit categorizes benign noise as danger, cascading a fight or flight response down the spinal cord. Misophonia is an evolutionary survival system that is actively misfiring. The sufferer is fighting a biological false alarm. Anyone can feel irritated by loud chewing in a quiet room, but ordinary annoyance operates entirely differently from clinical misophonia. To diagnose the condition, clinicians measure functional impact, a metric tracking exactly how much a particular sound disrupts a person's ability to maintain a normal life. They look for key functional markers. A diagnosis requires severe outcomes, like needing official workplace accommodations, massive relationship strain with family, or withdrawing from shared spaces. Misophonia also rarely operates in a vacuum. It frequently travels alongside other conditions related to the body's internal alarm and sensory processing networks. This Venn diagram maps out how misophonia heavily overlaps with generalized anxiety, obsessive-compulsive disorder, and various sensory processing differences. By identifying these exact overlapping conditions, a licensed clinician can design a targeted, customized treatment plan to finally quiet the alarm. Many clients experience profound, immediate relief the exact moment they sit down with a professional and learn their panic has a medical name and a physiological cause. Clinicians then introduce primary therapeutic interventions, which often include cognitive behavioral therapy, exposure-based strategies, and targeted sound management techniques. The clinician works with the patient to physically divert the incoming trigger sound away from the involuntary panic response, redirecting the brain to a tolerable baseline. Over time, this therapeutic uncoupling widens the patient's window of tolerance, allowing them to comfortably absorb everyday sounds again. With the right clinical tools and consistent work, the brain's false alarm system can be successfully reprogrammed. Coping and healing counseling is uniquely equipped to help patients retrain these complex sensory and anxiety responses. They maintain a diverse, culturally competent team of over 15 licensed therapists, including specialized LCSWs, LPCs, and LMFTs. Operating on a 100% HIPAA-compliant telehealth model, specialists are available via video across all 159 Georgia counties. Accepted insurances include Aetna, Cigna, Blue Cross Blue Shield, United Healthcare, and Humana for $10 to $40 copays. They also offer $0 Medicaid options. By removing geographic and financial barriers, coping and healing counseling gives individuals the tools they need to mute the false alarms, manage their distress,
and confidently reclaim their seat at the family dinner table.